Obinutuzumab is a new anti-CD20 antibody, building on the successes of rituximab, a standard anti-CD20 antibody which is currently in widespread use. The goal was to make it more effective in inducing antibody-drug dependent cytotoxicity, and that has been successfully achieved and is now being tested clinically to see whether it is better than the standard rituximab therapy. So in this trial, the study was specifically looking at the use of chemotherapy in combination with obinutuzumab versus chemotherapy in combination with rituximab, with ongoing maintenance therapy thereafter with either obinutuzumab or rituximab. And this study also met its primary endpoint, showing an improved progression-free survival for patients receiving the obinutuzumab treatment. Patients could receive that treatment in combination either with CHOP chemotherapy or with bendamustine chemotherapy or even with CVP chemotherapy. And across the board, the combination with chemotherapy was improved. So that's again an indication that has been approved by the FDA for the use of obinutuzumab.
The value of this is still debatable amongst clinicians, largely because we need to understand better what the role of PFS is when there's no overall survival benefit. There's been a multitude of studies that have improved PFS, for example, rituximab maintenance in this setting, but not overall survival. And this is an indolent disease in which treatments can be repeated, and patients may undergo a variety of anti-CD20 agents as they proceed through the course of their disease over time. While this study did demonstrate a progression-free survival benefit, the overall benefit of this needs to be understood with time. And personally, I do not generally use obinutuzumab for every patient with follicular lymphoma. There are circumstances in which I think a progression-free survival benefit may be very important. For instance, an older patient in whom if you feel that it's unlikely you're going to get multiple lines of therapy sequentially may benefit from an initial progression-free survival benefit. It is important to note that in this study, all patients received maintenance either with rituximab or obinutuzumab, and that too is somewhat debatable. So in patients who are not planned to receive maintenance or in whom the doctor would not give maintenance therapy, this study may not prove to be equally beneficial in the obinutuzumab and rituximab arms.